All right, well, Dr. Darien Sutton joins us now with answers to some of the questions that you have submitted online about health and wellness topics. The first one we have here: when can I get a booster for my 14-year-old?
That has to be my most common question I'm getting right now.
Really?
Many parents who are right now around 8 months after their first shot, and they're wanting to protect their children, and I get it, but I will say that the data is not yet in. What we do know is that the primary series for this age group is proving effective. We talked about this earlier in the week. If you look at the rates of hospitalizations and those hospitalized right now in New York City, and from the ages of 12 to 17, 75% of those patients are not fully vaccinated. So it just reminds us to make sure at least you get those first 2 shots.
And another question from a viewer about shingles. You know, I actually had shingles as a kid. I can tell you it is very painful. And this viewer wondering, is it possible to get pain after shingles?
Absolutely. And so many people are probably going to agree with the sentiment, which is that people often feel like they're made to believe that they're crazy. They're like, there's pain. It feels like I have shingles, but there's no sign or symptom or rash. And I have to say that it is something that is called post-herpetic neuralgia. So the shingles disease is caused by the varicella zoster virus that causes chickenpox in childhood. And as time goes on, that virus goes dormant, and then when we get older, our immune system kind of wanes, and then that virus reactivates into shingles. And unfortunately, after the virus goes, some people can have damage to those nerve cells that the virus lives in and have chronic pain that requires sometimes therapeutic intervention.
Thank you, as always, for keeping us on point. I know, I did not know that.
Another reason to talk to your provider about the shingles vaccine, because it can be preventative in preventing shingles and, of course, its complications.
Yeah. Another good reminder. Yep. And you can submit your questions to Dr. Darien on his Instagram account at dr.darien.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.